Hey, I'm Sarah Smith, family doctor, clinical day advisor, and the chatting coach. Welcome back to Sustainable Clinical Medicine podcast, where we're going to be interviewing peers or world experts who can help us think about our clinical day in a way that is more sustainable and create time for our lives outside of medicine. Hi, everybody, and welcome back. I have a very special guest with us today. Dr. Elisabeth Beg Hall is here with us, and she is an ADHD expert, so I know that's going to tickle your ears immediately. So I'm going to go ahead and let you introduce yourself. Welcome.
Hi, Sarah. I'm so happy to be here with you today. I really appreciate the work you do. Many of my patients love you, and so I'm really happy for this conversation. As you said, yes, I am an adult ADHD expert. I trained as a family doc, and then I trained as a psychiatrist, and first a child psychiatrist, and then moving into the adult area. And that's really been my time in the adult ADHD area is when I really got into really the whole story of what's going on with these children when they grow up, meaning us. And so, or meaning, some of us. So I think that's really who I am. Practice now exclusively with physicians who have ADHD, but that's really become more and more niche as I've been doing other things like giving a lot of talks, workshops, and things about executive function skills development. And so I'm super passionate about working with this population, really in any form. And I've also, I guess, had the wonderful opportunity to develop a number of really of programs like psychoeducation, psychotherapy kind of programs that are delivered to the general adult population. Many of those are available in British Columbia, where I live and work, right through the public health system. So it's really wonderful to be able to kind of build capacity everywhere. To get all of these amazing people with ADHD living their fullest lives is really what I think is kind of my personal professional mission statement. And then I guess on a personal level, I'm queer. I have a daughter who is at Next Steps, who's 27. I love to, wander around on beaches and kayak and try to be as active as I can. Yeah, so I have a good and full with my wonderful family and friend family as well. Yeah.
Love that. That sounds amazing. And I love that you have passionate areas to look after you as well. Now, tell us the journey from family medicine and then into psychiatry. Like what was happening in family medicine? What prompted going back to school? And because this is a different angle to
Yeah.
get to psychiatry. So tell us a bit about that.
Yeah, I mean, in Canada at the time, that was an option. So I'm kind of dating myself a bit here, but I started doing family medicine and, there was no training for running an office or running on time, beautiful, wonderful teachers. I loved family medicine. I loved the variability and what was going on with patients. Yet when I graduated right away, even despite, we do lots of practical work in family medicine, I graduated, but I was overwhelmed doing my locum work. I would be, you love this, charting until midnight. Missed some, the gay games were in Vancouver that year, and I missed all the parties because I was charting until midnight. It was like heartbreaking. Anyway, but it did cause it was like this might not be the best place for me. And at the time, then the opportunity to go into psychiatry arose, and that it turned out to be a better place for my passions. But I did enough family medicine to know so much of the challenges as well as the wonderful things about family medicine. So I'm so grateful for that opportunity, because that kind of sort of trying to be practical as much as possible really informs kind of how I do psychiatry. But still, charting isn't so easy. And then I guess the thing, yeah, so that's the sort of into psychiatry. But then I was a child psychiatrist, and really, although I was working in a center where there were some of the world experts in ADHD, Margaret Weiss, Gabrielle Weiss, others, I wasn't that personally, I wasn't that interested in it. I was a mood disorder specialist, whatever. But then after a while, I started working more in student health in psychiatry. And the thing I noticed was, these kids were coming in, they were not doing well. It was often around the end of school terms, right? And we would, I work as a team, and we would manage the mood issues or manage the anxiety issues. And they felt better, but their productivity, their ability to sort of engage in their classes really didn't. So they were stable. They weren't suicidal anymore, but they were still, really having trouble. And so that's when I was like, I think we're missing something here. And so our whole team at that time really went back and did a deep dive into what ADHD would look like in this population. And then we started to develop programs, and we used a lot of some of the existing work that's amazing, Mary Salanto, other people. And so I started to really get interested in this population. And the cool thing is that people got a lot better. And we developed wonderful relationships with students. We would do groups regularly every semester, and really, kind of fit with my belief that you can offer people a diagnosis in pills, but you really have to have the skills that go along with it, right? So it really ended up being a ton of fun. And that sort of one thing has led to another over the last almost 20 years now.
Okay, that's very cool. Was there additional training to move into the true adult population only? As you said, you're now doing mostly only adult psychiatry. Was that further training for you?
No, thankfully. No, thankfully, just doing the psychiatry. And then I did a child fellowship with that.
Okay.
But I guess, the other thing I should mention, so I kind of led with it, charting problems, organization problems. And it was kind of interesting because really wasn't until I had been in this student health job for probably, a good couple years. And we were doing all these programs. And then one day my colleagues, my friendly, lovely colleagues were like, "So Elisabeth, when are you going to get your own ADHD diagnosed?" And so I was like, "What?" So it was quite a bit later in my career, and getting a diagnosis was so helpful for me. I became a much better psychiatrist. I get a lot more done. I was able to really learn skills, but I don't know, have the benefit of kind of always teaching these skills. So I am learning new things every single day, and I had many years to kind of set up a system like this, but it certainly has been really important in my own journey to make a lot of things. It was all of a sudden, then I didn't blame myself so much about that, the time charting, the disorganization, I was able to sort of see that maybe it just wasn't the right thing for me, but also to understand that, many of the docs I work with are in family medicine because it's so challenging and there's so much variety and such. So I really developed anyway, it was better. It was better for me to know more about why this was so challenging for me.
Got it. Okay, well, that's very interesting because I know there's a lot of physicians who may have that diagnosis of ADHD much later, or finally kind of recognize it in themselves, or may never recognize it in themselves, but have such benefit from some of the skills that we use for ADHD prone human brains. I'm fascinated. How do we do high school, do medical school, come out the other side as doctors with ADHD? Like, is this possible? And I'm not, of course it is possible because we see it over and over and over. Both of us know this. But how did this ADHD brain manage to get themselves all the way through without a diagnosis, without medications? How does that happen? What are they doing that's been successful up to now, maybe? Or has been
Isn't it a wonderful? It's a great question. Sorry to interrupt, but it's a great question because I think that's one of the things that's so fantastic, right? Is that, so first of all, obviously, there is an amazing sense of intelligence. There is often so many other strengths, like, very good people skills to get through grade school, elementary school, or then even high school, whatever. When things weren't always going so well, often very, very good relationships with teachers get developed, often really supportive peer relationships. A number of physicians I've assessed with ADHD who are like, "Yeah, I just found this really great chemistry major, and we were actually best friends, and I just did everything they did. I just copied and followed." What I think one of the overall things, Sarah, is this has great creativity, right? It's like, "Oh, I don't know how to do that. I'm going to figure out a workaround." So, I think tremendous capacity to apply intelligence, executive functions, personality characteristics, curiosity, flexibility, modeling, all kinds of things is sort of one big piece of it. So the personal thing. And then I think we also, see in physicians an amazing persistence and that capacity to persist. And so meaning that not all physicians that that we see have had the privilege of any background in medical families or things. I certainly didn't have that. And, people they have a certain kind of strong belief in themselves. And then this amazing persistence of like, I am going to, sometimes it's also a little tiny bit on the, I'm going to show you a little bit I hesitate to use the word oppositional I wouldn't use it in a clinical way, but it's like, don't show me how to do this. You guys have been telling me how to do things for my entire life, and that didn't work so well. So again, this capacity to build a workaround, so it can lead to really, really great things. But again, still, how often I hear when physicians come to me, either they say it, well, I have a medical degree, how could I possibly have ADHD? Or somebody a key person, unfortunately, along the line, an assessing physician perhaps has said, how could you possibly have ADHD? You're a doctor. Like, it's really, so I really believe that this, the challenge, the internalized and externalized stigma about what people like ADHD, what people who have ADHD look like, I think it's really alive and well, and certainly in medicine. So, yeah.
Yeah, okay. That really helps. And because when we hear some of the diagnostic criteria, like difficulty being successful at like anything in any area, then you're like, well, that's clearly a no in got through medical school. So I like that determination or grit or persistence, at least in some areas, may not in all the areas. Maybe you do have unfinished hobbies at home and things, or the piles on the desk are bigger, but the persistence to get through this. And then out the other side, so you're in the clinical space and you're like, but I can't do this charting thing, and the inboxes are piling up, and I'm working till midnight getting it done. Is that common for physicians who got themselves through medical school, but now they're dealing with the day-to-day? It's familiar and probably boring, and the paperwork part is boring. Is this pretty common that they've got big backlogs or incomplete charts, incomplete work?
Yes. Simple answer, yes. Very, very common. I think, and I think it kind of comes in child psychiatry, like we use that concept of scaffolding, right? Like as parents, will support, like we have a regular bedtime and you have, regular lunch or whatever happens for people. And that sort of supports that a family might provide. And so there are these places where ADHD is more likely to show up in an intelligent, resourceful, I don't want to say highly functioning, because as you mentioned, I think there will be, there has to be areas of impairment for the actual diagnosis, or historical areas of impairment that you'd really want to look at. But I think this idea of scaffolding, so often like someone goes away to university, that's when it's like, whoa, nobody ever noticed before. This person gets no feedback now in university, or very limited feedback. And then, or any post-secondary education, all of a sudden they're perplexed. They have no one telling them what time to go to bed. And then there's that fabulous little distraction of the cell phone and the dopamine hits that come from it. Like, it's really, and then there's alcohol and a few other things to make things interesting. And I think that happens, like, so then usually people, that's often a diagnosis, a time for diagnosis. But then this another kind of time when that occurs is like for a physician, when they would have a baby. That can also be a time when, again, something is disrupted in a previously set up schedule. I see it a lot when they have like baby number 4, or, it's like, oh, this has been awfully fun, so let's have baby number 4. Or when they take on another leadership position, which again, ADHD docs are very prone to do. And also just the starting into practice, again, is really a different skill set than the scaffolding of medical school or, healthcare professional training, right? It's always quite rigid and structured. And, it's usually in the residency when it starts to get a little iffy. And then by the time they're out, then these challenges can be really, really obvious. So a lot of different times. It also, again, menopause can be another time. So you can get fully, that's a little bit more my story, like fully functioning, not without areas of challenges, right? Like historically, retrospectively, it could easily have been identified if one was looking for it. So I think those kinds of divorce or other kinds of significant changes in family structure, I think, can also affect, or illness or challenges with children or any of those things, right? Big job changes, transition.
Yeah, that makes a lot of sense because I think they're all further exhausting pieces to our brain, further hats and roles and responsibilities that we have to wear. So I'm really happy that you highlighted that because I think the question of what's wrong with me just
Right?
comes up over and over for physicians that I meet who are struggling in the area of their administrative burdens and things, and they're saying, why now? Why is it so hard? What's gone wrong? And like you said, I'll meet them at menopause, at postpartum, or they're in a pregnancy and they're like, well, I'm not going to be able to do this with an additional insult on my sleep and my routine. There's
Mhm.
somebody else relying on me. Yeah, absolutely. So I think that really helps us identify why, what has happened. Do you find burnout's another one where people are, they've been in practice for a while, they've added those extra responsibilities, they're kind of, I hear the word, I'm stretched thin. Is that another time? Is that something that happens to our executive function as well?
Yes. So I'd like to get to that, but before, I just thought
Mm.
of another thing I think that's important with the idea of physicians, and from what I'm doing now, like a more executive function skills training for physicians in general. So I'm kind of comparing what I see in the ADHD, diagnosed groups as to those in general. And I still think it seems to be something that's part of medicine, maybe our culture. And again, maybe we can change this, but we compare ourselves, right? I'm sure you hear this a lot, right? We judge our own clinical capacity on the basis of how we are with others. And I know that we compare ourselves to something that actually isn't true. It's like we imagine an Instagram profile of our colleagues and they never seem to be stressed and no, everything is going so well. And look at their beautiful charts. We have no idea what they're doing most of the time when they go home. And I think this comparison sort of cognitive distortion or error that we make is really, really powerful in developing that, so sustaining that internal sense of shame and really getting in the way of seeking help a lot. And again, I think as we're both talking, it's like you don't necessarily need a diagnosis of ADHD to get help in these things, but this sort of culture of perfectionism that we've built in medicine. And again, it's understandable that this has been built, yet it needs to soften a little bit in order for us to be sustaining ourselves. And then to the burnout point is, yes. I mean, the other thing that I notice a lot so I do these ongoing groups with physicians. So for about the 4 years that I've been running these groups, some of us meet twice a year right throughout the year, same people, 3-4 years of what I'm seeing. And the thing that I notice is a very strong moral compass, very, very strong sense of wanting to do the best for our patients. Like, again, all physicians have this, but my hunch is this might be, the ADHD type physician group might be a little bit more identified with this. So, and then sometimes with that comes a tiny bit of, it's really the identity that we take on as a physician and a little bit rigid, possibly around the edges. Like, a good physician has chart notes that look like this, right? They're nice and long and they have every possible detail, that would ever matter. And I must answer my patients' emails like the identity is very much all things to all people, as opposed to an identity of I'm another human being. I have certain strengths. So yes, I do think that these physicians are more likely to burn out for a number of reasons. And also, like, if it is ADHD, we know that those conditions, depression, anxiety, a little bit more closely associated with that. So these individuals might be more likely to go in that direction anyway. But to normalize it more, it's really believing so strongly and having so much trouble letting go of that identity, or just like softening the edges a little bit, right?
Yeah. Okay. Got it. Let's move into then some of the things that are helpful for physicians who are struggling, who are identifying some of the things you've talked about with possibility of ADHD traits or just the other pieces where they're struggling. What are some of the tools and things that you're using to help them be more successful in their day?
Yeah, I mean, of course there are a ton of specific tools, right? Learn how to estimate your time, thinking. Sorry, it would always go back, I think, to executive function skills, right? Because we know that many conditions, many personality styles have, there are executive function challenges for lots of different people in lots of ways. Plus none of us have a full slate of skills, right? And I know listened to some of your podcasts, and I know you talk about executive function skills a lot. And I think that, this is, so whatever we can do to support our executive function skills in general is obviously really, really key. So I think it's really important to mention that, because sometimes I think even when I'm teaching family docs about how to diagnose and manage ADHD in their patients, like sometimes we forget is like, when you help your patient make a proper sleep goal, right? Like when you help them get enough sleep and put away that phone and put themselves to bed, despite it being desperately boring, that is supporting their executive function, like amazingly, right? When you encourage them to eat at small times during the day to support their functioning even later in the afternoon with, a little bit of glucose, making sure that their cognitive fatigue that is, typical and to be expected for a physician with ADHD, given the load. And it's also expected for any physician, right? These days we've like overloaded ourselves. So again, sipping a little glass of apple juice very, very slowly. I'm not advocating, I don't want to get any nutrition people upset, but it's important. Like, how do we support ourselves? Making sure that we have little bites of meals throughout the day. So any of those things, like do we move? Do we do a box breathing? At lunch, you don't have time, but say you just give yourself 3 minutes for 8 rounds of box breathing. Like it's, any of those things that we do for our patients, for ourselves, are really supporting our executive function. So that's kind of on one level. And then I guess on the other level, there are really those important kind of nuts and bolts. And, we can talk about those, but from my perspective, what happens when we use these skills is that they get embedded, like they're kind of a way to learning and knowing ourselves better. Because often, like, we can tell people to go, track your time, like pretend you're a lawyer and track your time in 15-minute increments. And it can be really helpful to utilize a skill like that. But ultimately, when you do that, I mean, you need to break those things down into much more reasonable things than I used to tell people, like, track your time for a week. It's like, oh, Elisabeth, what were you thinking? Right. So now we talk about, track your time for an hour, track your time, in the morning when you're having challenges getting, you, your dog, your spouse, your family, whoever out the door. Try to be curious, see what happens. So and then when you do that, though, then ultimately you have to set a time in your day where you reflect, right? Because you can't just track your time. What are you going to learn from just tracking your time if you don't go back and sit back at it? So again, to me, it's an opportunity. The minute you reflect, then you're starting to think, wow, like what expectations did I have about the hour that I was shoving myself and everyone else in the family out the door? No wonder everyone forgot their backpacks today, or whatever the story is. You start to begin to see that, well, this wasn't actually realistic, right? This time of year, this season, right? People are out shopping. There's a lot of traffic. Like, what would have made you think that you could do something that at 7 a.m. takes you 20 minutes to get to somewhere, and that 2 p.m, like 20 minutes? Like, no, right? So then we start to really reflect and we begin to think about, then we get a chance to be kind to ourselves, right? We get a chance to like readjust our expectations. And it's not about like having an excuse, right? It's not like I have ADHD, like, oh, everything takes me 3 times longer. No, it's not that. It's like, ah, oh, sweetie, what were you thinking? It's okay, right? You are not going to get your grocery shopping done in this half-hour break you have from your office today. Like this is not going to happen, right? So it allows us to kind of gently over time change our behavior. So I know you're asking for more practical things, but I do think like the practical piece starts with having, paying attention to the very basics, knowing that you can't do all of those things at once, and being very realistic and kind to ourselves while we're in the process of it.
Well, I think that I like this approach because it's notice and know yourself. So I think when we ask physicians to say, when we ask the question, what do you need to be successful in your day? That's a massive question. It's really hard to answer. And you're like, I don't know what the options are. Give me the list of things to choose from, and I'll tell you what I need. But even then, that's not necessarily going to make it right because, like you say, we may have physicians come in and say, oh, I used this time awareness tracker and it was amazing. And that works for 5 minutes. And then they forget that it exists. And so, sure, might work for a minute. So, like you said, practical or like, here's a list of things isn't necessarily going to fix you. It's the, like you said, step back and say, what is it about me that I can notice, that I can learn from, and then I can put in place some things that could be helpful to me in the way I work. And this is very useful because, yes, the tracking thing, I did the tracking thing. And I was so grateful that the person who told me to do the tracking thing said, do a regular Monday, and then another week, do a Tuesday, and then another week, do a Wednesday. Don't do like all of it in one week, or you're going to be completely like overloaded by this. And then what do you notice about it? And for me, when I reflected back and I saw all the things I was doing between patients and all the things I was trying to get done in a 20-minute, like, I love that. I'll go do my groceries in my lunch break of like maybe half an hour's left of it. Yeah. I just laughed. I'm like, who hasn't done that? It's like, oh, just zip to the store and blah. No, that's not, just getting there is going to take me 10 minutes. Getting back is going to take another 10 minutes. I can't do a full week's grocery shop in 10 minutes. That's not going to happen. And that's not going to be a nice way to look after myself, ready for the afternoon. So I
Yeah.
love this approach of step back, notice,
Yeah.
start seeing how you do things, why you do it that way, what would be a kindness. Lovely. That's lovely.
Well, and if I could also say, I love what you're saying, because of course it does always start with awareness, right? And, I use a lot of box breathing. I'm sure you do things like that, right? To just, it's not to make everyone into a meditator. It's just like, just finding, like sometimes just finding that moment to just pay attention to what is amazing. The other thing that you mentioned, which I really agree with as well, is we've got to personalize this stuff, right? Is it one size, one app for somebody could be like the absolute bomb. And then, one app for that same app just doesn't work for somebody else, right? It can be a really big challenge. So I really like, yeah, we're very aligned.
I know throughout my early career, I desired this pajama party where I'd get together with my colleagues and do our inboxes together or do our charts
I
together.
love it.
I somehow thought that would be the cure for my mounting mountain of incomplete work.
Yes.
No
Yes.
one ever seemed to think that was a great idea. But since those days, which were before Zoom and before online and before that, there are huge numbers of places you can go to work alongside others, and
Right.
they're very popular. We have
And you
Backlog Buddies.
offer those. You
That's
offer.
right. Backlog Buddies is one of the ones that we have.
Yeah.
But tell me about this is the boring part of the day. You had this challenge as well with the incomplete charting and this mountain of work that just takes hours when you're left to your own devices. And is it, why does it take so long? How do we start? What are some of the things you've learned along the
Yeah.
way to help physicians with this mountain? Because the
Yeah.
mountain is the boring part. You're not getting paid for it. It's soul destroying. It's not fun ever. We hate it. We despise it. There's too much. There is too much. There's
There
literally
is too
too
much.
many things on your
There's
plate,
too
all of
much.
you. We get that. We absolutely understand that. What are some of the things that are helpful to consider about the mountain of incomplete work? If you've got some ideas or perspective on that would be really helpful.
Yeah. So again, I think keeping in mind the kinds of things that we've already talked about that we really agree, like those are really key. And then I just want to say that well, I was talking about, you and I talking together in my groups this week, and someone's like, yeah, I just signed up for Sarah's, I don't have the exact name, the buddy
Backlog buddies,
one. Right.
the
Backlog
holidays, yeah.
buddies. I'm looking forward to it. I know I'm going to get a whole bunch of stuff done. And I was thinking, well, I should join you too. But so,
Totally. Come along.
well, again, like it's a great resource, and you're right. There's lots of places to do it, and we can also DIY it as well as if we want to, right? Yeah. So, executive function skills are all about the dopamine, right? It's all about the dopamine hit. And well, it's about a whole bunch more than that, but certainly in this kind of case where things are boring, and a lot of people find that at transition times too, like people will say, well, I don't want to go to bed, I'm bored, right? It's boring to go to bed. But so the boring thing about work and charting pieces of work, I mean, I really I think so. This is the thing I think that's interesting about all of these things is that we can, there's a lot of research on executive function skills. I think the ADHD world knows a lot more about executive functioning than most other worlds, which is why I've started to teach everybody about this. But the truth is, like, you really can't pull it apart. Like, what skill is this, right, that you're doing when you're working on something boring? You can imagine that, you do need some dopamine. Like, you need some way to pay attention to your progress, to know that you're getting something done, to feel good about what you're doing. And it's kind of working against, well, it's like it's, of course, every app around and every iPhone or cell phone of various sorts were made to give us dopamine hits. And so we really, I kind of think of it as like a bit of an anti-establishment thing. It's like, we're taking control of our own microdopamine hits here. And so you need to set it up, right? So, I mean, much more about advising people specifically around charting than I do. But one of the pieces that's always important when you're doing anything that's boring is, what are you doing to monitor your progress, right? So you have your metacognitive skill. You've got to be able to step outside and say, okay, well, I have a time block, a magical time block of 2 hours. I am not in Sarah's program. I'm going to do these things by myself. Then in 2 hours, as we all know, you could end up looking up some fascinoma on, your latest medical AI program, right? Like 2 hours could be nothing, right, in this story. So, some of the things is like to get the metacognitive piece, but to know where your challenge is most likely, right? And I do have, colleague patients who, the latest one I heard, which I'm sure you've heard this before, it's super brilliant, was like a hospitalist person who is doing handovers and really, again, fabulous physician, intelligent, wants to change this patient's life, wants to make a great offering for this patient. And then what happens is they're, diving down every hole and solving every problem in handover, when, by the way, they're tired. They've been working for 10 days, lots of, long nights, long days. They really want to be home with their family. They probably forgot to bring lunch, and they don't want to, they just want to go home. But so recently, one of my colleagues talked about going and did the work in their car. They went into their car where they had no cell phone access or no Wi-Fi access. So they couldn't look up or go down any. So again, what I love about that is that there's environmental things that you can do around yourself, right? You can put on headphones. I'm a big fan of these horrible situations where we make our colleagues think while you're dictating in a nursing station, like, oh my goodness. And trainees, we do this, like, oh my goodness, right? Or, where all dictations happen anyway. So nice headphones to really give a visual barrier of what you're doing as well. again, if you're doing this, like controlling your environment as much as possible, the fabulous sign on the door, thanks for thinking of me, but do not knock, something funny, something a little bit, whatever, but the clear message is do not come in this space right now because I'm working on this. Like truly controlling the access that you have to information. So that doesn't now make it less boring, but it makes it a little easier to get something done. And then again, the planning kind of skill is that capacity would be to, well, how many charts, or say you're doing charts, or maybe it's disability reports or whatever, that how many realistically do I think I can get done? And then maybe what you do is multiply that by 3. Right. And then when I usually tell docs to do this, if you're not too clear on how things will take, I always multiply it by 3. And then if it's less, well, that's fabulous. But most often when we're not used to estimating time, it tends to be 3 times longer than, we think it's going to be. So then to kind of be realistic, like, okay, so what if in this 2 hours I thought I could do, 6, whatever it was, but maybe I'm actually going to see what happens with 4, and I'm going to really closely monitor. And then comes in that identity piece about who is my audience? Who am I doing this for? Is this my mentor that I had when I was a first year resident who told me all those inspiring things about being a physician? Is this, who do I think is going to really read this? Right. I know for myself, like if I know my psychiatric assessment is going to somebody who's like the head of, God forbid, neuropsychiatry or department head or whatever, like I'm like, oh, forget it. This is never going to get done. Right. So I say this to illustrate like the way we think about these things can really be, a challenge. And then the other recent one that I heard about these kinds of things is to really change, again, these are long processes. They don't happen quickly, but another colleague was mentioned, I changed my identity about what's important to me as a physician. And I put less weight on the detail in my charting, right? It's like, again, I know you're doing this in probably much more practical ways, but I thought those were such cool things. So you want to get the dopamine hit, so you have to have a way that you're actually noting what you're doing in the middle of it. Usually you have to have a lot of time awareness to make sure you're not going down any rabbit hole. The other thing is using if it is ADHD, you can use some of your ADHD strengths in your favor. So for example, the hyper focus that people talk about. So that is, of course, this capacity for sustained attention, right? And so we know that ADHD is not an attention deficit. It's really an attention application challenge, right? It's like, I'll apply my sustained attention to, my Netflix, but not to my charting, right? But again, to use it, like I really encourage people to, like, if that's your strength, then go for it. Like, make a false deadline, do all kinds of things. Like we think, oh, that's just silly, whatever, but every tool is a good tool, right? Every little approach that works for us, right? I do have problems sometimes when people are like, again, well, this app will really help you get it done because this is going to do it. But then, the app takes an hour and a half to set up. And it's so complex that you got to go learn, you got to do videos to learn this and that, right? So again, I don't know if that's specific enough for you, but the idea about how to make something. And then just one more thing about that, it's that maybe there's a way to go underneath the boring. Like, for example, when people say, I don't want to put myself to bed at night because it's so boring. This is often a parent who's also a physician, maybe in a relationship with a physician, may have children who might also have ADHD. So, things are not easy in the home, and possibly has some support, but not enough support. And then they get to the end of the day. And excuse me, but who has had a moment to actually have a virtual cup of tea with yourself, or just think about your day? Who's had that? Well, of course you don't want to go to bed, right? Like boring it covers up some of those underlying feelings and emotions. And again, I find that when we use our executive function skills, it's kind of like this gateway into understanding ourselves better and really knowing who we are, like really finding a way to meet our needs in much more meaningful ways. It's like, oh, right, I got to build this in, right? I got to find a way, metacognitive skill to plan, maybe I start booking a couple hours off in office on a Thursday morning. Maybe I do something to really, I've depends on how assertive you're feeling about it. Maybe sometimes people just, have a headache for a little while. Sometimes we need to just just take care of ourselves in whatever way we know how to. Like, we don't all have to be the most assertive or clear communicator in the world. That's an ideal to work to, but we need to be able to take care of ourselves, right? We need to, do this. So
I love that. I love that you use bedtime as an example, because I think that's so common for all of us when you've just had such big days and then you get to the end of the day and you're like, I haven't had a minute and now I'm just procrastinating bedtime away. Such a,
right,
such Mhm. Now, what
right.
haven't we talked about that we should talk about? Some perhaps take-home messages for us, or things that
Yeah.
places we didn't go that we should talk about.
Well, I guess, the thing that I really find interesting about executive function training is there are very specific executive function skills. The one I'm pretty into these days, I did a deep dive over the summer into cognitive and psychological flexibility, because that's, really important for how we sustain ourselves in challenging times, in addition to the challenges of, added EMR burdens and other kinds of issues. We really need to find a way to support ourselves. And I think what I find so interesting about executive functions in general is that these are really ways that we, learn to, again, be kind to ourselves, give ourselves some time, diving deeper into perhaps like challenging ourselves to be a little bit more open, a little bit more flexible, to pivoting, to changing, to looking at things in different ways. I think a lot of the basic core cognitive behavioral therapy skills, like changing how we think about a situation, can really, really help us feel better. And changing our behaviors too. Like, that's the other thing I think is, this idea about, like, we really want to be able to notice our accomplishments. So cognitive flexibility is kind of, I think, one of the key ones. But again, to understand that when we're like, again, dealing with a boring task, you're suppressing a response to go watch Netflix or have a milkshake, or, a milkshake might not be bad given the glucose in there to help support. But, like, when you're having this kind of experience, you really are utilizing a whole bunch of different skills, right? And so I guess the thing that, one that I guess maybe just a really practical tool to leave people with is one that I've been working on in varying. And if you see me in varying contexts, usually it means different things at different times. But this idea of a 3x3 kind of approach, right? So yeah, we're busy. Yes, we don't have time. Yes, we have too much on our plates. We do. We really do. And could 3 minutes be possible? Like, what about just 3 minutes? Like 3 minutes at a time of the day, usually maybe not at the end of the day, because we don't want to overwhelm ourselves, but 3 minutes to think about like three amazing things I got done today, or three amazing qualities I brought through today in the world. People sometimes do three things I'm grateful for. I want to like expand that, because you can think about, like, if you want to work on, for example, being more flexible. Well, here, I actually was going to take the bus to work today, but, the bus was running late and I hopped an Uber. That was actually flexible of me, right? That was a real change. I pivoted really quickly instead of getting all upset and being late and whatever. I got really resourceful. So, like, what are three things that you're kind of working on that you really did well? It could be, again, three ways I was more attentive, with my spouse, my partner, three ways I was a better dog parent, whatever it was, right, that you're looking at. So 3 minutes, three good things. And then thinking, bringing our metacognitive place to tomorrow. Like, what would be three ways I could bring this forward tomorrow if I'm working on something? Or what are three things I could do tomorrow that really actually will help me, again, just live my life a little bit more easily, not, write a book, not finish all those, disability forms, but maybe one of them would be, I'm just going to give it a few minutes and look at what I need to fill out the hardest one of these. Or maybe I'm going to let myself do the easiest one. So again, we're using planning skills, reflecting skills, supportive skills toward ourselves to really think. So 3 minutes, 3 good things, 3 things for tomorrow that are realistic.
I like that. That
A
makes
way to start change, right?
simple and small ways to start. And I love that. Super, super helpful. Yeah. So good. How do people find you if they're looking to reach out and work with you or learn more about what you're doing, or have you come to do a workshop?
Yeah. I have a website. On the website, there's access to how to get hold of me. The one thing is I am starting a North American group for docs who are interested in a review of executive function skills overall. And so that group is starting, I'm not sure when this episode will air, but it's starting hopefully sometime January, February. So people are very welcome to join me there. And my website is ebhallmd.com. So like Elisabeth Beg Hall at md.com. But I think you'll have that somewhere. But yeah, I'd be happy to reach out, chat with people. And again, as you say, you don't have to necessarily have an identified disorder, challenge, mental health issue to want to improve your executive function skills. And so, I'm happy to talk with people about workshops for their teams or digging down into these skills a little bit more. Yeah.
Love that. Thank you so much for your time today. I think all of us are going to have heard something that made sense and may make life a little easier or nicer on themselves. So thank you so much.
Thank you, Sarah. What a great pleasure to chat with you. Thank you for your work. Really, really appreciate you.
Thank you. All right. Bye, everyone. Have a great week. Hey, if you found this podcast episode helpful, I would encourage you to like and subscribe. Every time you do, you help a colleague or friend find our podcast, and it can help them too. Don't forget to share it along with your friends. If you're looking for extra help, don't forget we have Charting Champions for physicians and Smarter Charting for nurse practitioners and other clinicians to help you get home with your work done. We are helping you create sustainable clinical medicine. Thanks for listening.